Hello, I am Dr. Carol Penn, doubly board certified in family medicine and obesity medicine, and also a master movement meditation and mindset coach. I'm here in New Jersey. Excited to talk to you today.
Hi, I'm Dr. Kathy Farah. I'm board certified in family medicine and in holistic and integrative medicine. I'm here in Western Wisconsin where I practice family and integrative medicine, and also I practice in Minneapolis, Minnesota. And we're excited to give you a thumbnail sketch of our accredited course that's coming up, Unpacking Racism for Healthcare Professionals.
Oh, Kathy, could you tell everybody a little bit about the course of Synopsis so they know that why we're excited and they'll get excited too?
Great. I'm happy to. So this is a 6-week course, meeting once a week. So it gives you plenty of time to practice. And what we've done is we've brought really, I think, the best of evidence-based neuroscience and our practical experience. With all the social unrest that there's been in particular the last year and COVID-19 highlighting inequities that have often been racially based, have you had the feeling that you want to do more? Perhaps the need to want to do more and you really didn't know what? Have you wanted to say something and you didn't know what? This course helps you understand the neurobiology behind that and gives opportunities to balance your nervous system while you're learning techniques and are guided through those types of conversations. Dr. Carol, why is this important for healthcare professionals to take this course?
I think it's critically important for healthcare professionals to take this course. We take an oath that says, first, we do no harm. And yet, when we look back historically into our field of medicine and healing, harm has been done, and it has been done disproportionately across several groups. And people who are part of those groups, they come before us, and there is not quite the trust. And studies show that when there is less trust, it's less likelihood that the patient is going to be fully open with you, is going to disclose with you. And if we don't know the history, then how can we live up to first do no harm? So we start there. We start by asking us all to take a look at our intergenerational biases, our racialized biases, to unpack that, if you will, so we can get into the heart of the matter with you as an individual. And we do this in a safe environment, in a discussion format. So the next time you're in a staff meeting, when you finish this course, you should be able to step up to the plate and say something if you are moved to say something. The next time you're in a room with a patient and that patient doesn't look like you, and you've got that little thought to dig a little deeper, but yet you experience a hesitancy, is the patient going to like me? Am I going to say the right thing? You will feel empowered to say the right thing because we do integrate role play into the course, along with the neurophysiology, the neurobiology, and if you will, the neurospirituality that we put into every session to really, really deepen the experience. So you finish the course with a set of skills, if you will, that are immediately applicable in your professional life.
That's fantastic. And I know for myself, it's made the difference for me as Carol and I have had many conversations over the many years of, what it's like for her to travel in the world as a Black woman and myself as a white woman. And I know for me, I've been able to do that extra question. For example, what's it like, to be a Black child in this situation in the world right now, for example. I also think it's important to point out that these are evidence-based strategies. We're incorporating mind-body strategies. So if I feel that shame, which I often do, or if I feel my heart quickening, what can I do about it? We have a whole series of evidence-based mind-body strategies. That's why this course is CME approved. So I think that's unique, and we're proud of that. The other thing, as Carol mentioned, we talked about doing role plays and connecting and sharing. There's a rich science of connection as well. So we're super excited that there's a 2-for-1 offering. So you can invite a friend or invite a colleague to travel this journey with you. Carol.
Oh, we are so excited. And I think we have time for a quick story. So, just a quick story. And I know you share that story that after the murder of George Floyd, you had an African American, I believe, as the father with the child, and you felt, let me ask the child this. What is going on for you? And had you not asked that question, you would not have gotten the full history. Could you say a little bit about what happened after you asked that question?
Yeah, and even just a little bit more background. Of course, I practice at Children's in Minneapolis, which is literally blocks away from the site of the murder. And I asked that question, and actually, one of the interesting things is that that particular child has been thrilled to be home at home, and was at the time anyhow thrilled to be home rather than being at school because he wasn't being bullied anymore. And
Mhm.
and we talked about it, and the parents talked about, and the mom actually came in the room too. So as both parents and the son, they're like, "Yeah, we have to talk to our children about what it's like be growing up Black." And I feel like we had a real connection, and it's that kind of connection I think is why we went into medicine in the first place.
Yeah. It's so beautiful, that richness, that intimacy. I know that is one of the things I love most about being a family medicine specialist because you can just have it across the generations. Well, listen, you can tell that Kathy and I are very excited, and we want to invite you into this space and be excited with us. And we're looking forward to working with you over the 6 weeks of this course. Thank you so much for listening.
Thank you.